For veterinarians and veterinary technicians, the exact locations of the valves, P, A, M on the left side and T on the right side, are important. For most horse owners, though, the main thing is to be able to find a heart rate. And again, that's just going to be immediately above the elbow or the olecranon bone and just behind the musculature of the shoulder. Finding the specific valves for owners is not a critical feature, again, because heart rate is going to be the critical piece of information that's going to help you and your veterinarian decide the health status of your horse. How to get a heart rate. Because horses like to move and twitch, it can be difficult to listen for an entire minute and obtain an accurate heart rate. So to simplify things, what we normally do is listen for 15 seconds and then multiply that number by 4 to give you the heart rate in beats per minute. So I'm going to listen for a 15-second period. After 15 seconds, I count 10 heartbeats. So if I multiply that by 4, that gives me a heart rate of 40 beats per minute. So her resting heart rate is 40 beats per minute. Lastly, another component of the cardiovascular exam of the horse is to palpate the pulse quality, and that can be done in a few different locations. First, we'll review the facial artery. That can be palpated as a distinct band running over the mandible. And if you pass your fingers from forward to backward, you'll eventually find a band. And once found, if you keep light pressure, in most horses you'll be able to feel a little bit of bounding, which will be the pulse of the facial artery. Another location is to palpate that behind the eye in the transverse facial artery. So I'm on a line directly caudal or behind the eye. And again, I'm feeling for a band that runs almost horizontally and feeling for a bounding pulse. And in most normal horses, it should just be a very mild or faint bounding or pulsation. Another important place to palpate for pulse quality is in the area of the digital arteries. One place to feel for those is in the area where they course over the sesamoid bones. Again, you'll be feeling for a linear band, and if you gently palpate most horses, you'll feel a faint pulsation. You can feel these same arteries along the pastern area. There's one on either side of the fetlock and pastern area. The significance of these lies in the fact that they can be indicators of laminitis or founder. Horses with laminitis or founder will have an increased or elevated bounding pulse. In other words, the pulse will be much more obvious than it would be otherwise. So it's important to get a feel for what normal is in your individual horse.